the new regulations, and what kind of strategies are they taking to be in compliance?
You know, the first thing they're doing is calculating, are they over 50 or under 50? And the key thing is, if you're under 50 employees, this doesn't really affect you, other than it's going to be a new option for you and your employees. So that's relatively good news. I mean, we still see premiums going up, but it's a new option. For those over 50, I mean, they're employing a number of strategies, from reducing salaries. Business owners are in the business to make money, and most businesses, their margins aren't this big. They're this big, they're razor thin. So they're reducing salaries, they're hiring not full-timers, they're hiring people working 29 hours. Or they're trying to comply with the law the best they can and offer the coverage, make it meet the minimum essential guidelines, make it meet the affordability test. The affordability test is if an employee's wages are less, 9.5% or less of their income, the box 1 on the W-2, that's what they can be charged for the insurance. So for instance, real quick, 9.5 is roughly 10%. So if somebody makes $40,000 a year, you can charge the employee $4,000. So they're moving away, they're starting to move away from fixed contributions to contributing based on a percentage of their income. And what we're finding is, and this gets to the pay or play a little bit, is that it almost never, you know, we've done analysis, numerous analysis, it almost never makes sense to pay the penalty and not offer the insurance. A lot of reasons for that. One is it's non-deductible, and two is it only has to be affordable for a single person. I don't know what was going on when they made these laws, but it only has to be affordable for a single, not for the employee child, not for the family. And essentially, what we're finding is, you know, we've looked at companies where we thought, all right, if you pay the penalty and don't offer insurance, typical examples, we have a company with 800 employees. They offer insurance now to 200. So we looked at offering to all 800. If they offer all 800, or if they don't offer insurance, they're going to pay $1 million penalty. It's non-deductible. If they offer the insurance, and they're in the home health industry, so there's no room in the wages, there's none. If they offer the insurance, it's going to cost them, if everyone took it, roughly $1 million. But our analysis at the end of the day, and this is what a relief to most companies, is that based on using the 9.5 or switching their contribution strategy and understanding human behavior, if people aren't taking it now because it costs them $200 a month, they're not going to take it in the future because it costs them $200 a month, that it's going to cost them roughly $100,000. Their biggest headache is going to be HR and administrative, because they're going to get a nasty letter from the IRS, Department of Labor, I'm not sure who's giving the letter, I'm sure Steve can tell me, saying your employee went to the exchange, said you didn't offer it, prove you did, or pay us $3,000 penalty. And so that's what we see in some of the biggest headaches. So again, just cutting hours, reducing salary, offering insurance, but also offering a worse plan, not the plan that they're offering now. Because the old 80-20, it's really the new 60-40. Because to meet the guidelines, it's going to have to cover 60% of the out-of-pocket costs. So that means there's going to be a 40% for the employees to pick up on some back-end way. It depends on how the plan's designed. So they're going to get worse coverage, and it's probably going to be more money. Not the best of news.